Hello and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Obesity is one of the world's greatest health crises. Most of the world's population lives in countries where overweight and obesity causes more deaths than underweight. While many obese people live with diseases such as diabetes because of their high BMI, not everyone realizes how much their long-term health is at risk. Obesity can significantly increase your risk of many diseases, and obesity and hormones are linked. Promoting a healthy lifestyle, not just weight loss, and having an open dialogue with healthcare providers can reduce the likelihood of developing obesity or obesity-related health conditions. We have with us today eminent endocrinologists to provide medically accurate advice on preventing and managing obesity. We're joined by Dr. Gayatri A. Ghanekar, consultant endocrinologist, Zen Super Speciality Clinic, Dombivli, Dr. Sneha Kothari, consultant endocrinologist, Global Hospitals, Mumbai, and Dr. Mahesh Chavan, senior consultant endocrinologist, Apollo Hospitals, Navi Mumbai. Thank you so much, doctors, for joining us on the program. Dr. Ghanekar, if you could first tell our viewers what is obesity and what is the prevalence of obesity in India?
Yes, thank you. So obesity basically means having excessive fat, which is abnormal, which poses a risk to health. Okay, so fats is of two types: the subcutaneous fat, which is fat layer just below our skin. It is not so dangerous, but the visceral fat, which is in the central part of the body, which is fat around the internal organs like liver and pancreas, is associated with increased health risk. So if you are talking about numbers, so body mass index or BMI more than 30 kilogram per meter square amounts to obesity, and BMI more than 25 means overweight. So these individuals are definitely moving towards obesity unless they make some significant changes in their lifestyle. As far as prevalence of obesity in India is considered, according to data, the prevalence can vary depending on the sex, the background of the patient, from 12 to 39%. But practically we see that around 40 to 45% of the adults are obese, and it can vary depending on the urban or rural background.
All right, Dr. Chavan, does obesity run in the family? Is it a hereditary disorder, and what preventive measures can one take if obesity does run in the family?
So, almost 40 to 75% of patients have hereditary factors in the generation of obesity, and these patients who have propensity for developing obesity need to be careful about, because the genetics of obesity, there are multiple monogenic forms of obesity and multiple syndromes which are associated with familial syndromes which are associated with obesity. So there are quite complex syndromes like Bardet-Biedl and pro-hormonal and multiple syndromes. So, but overall, as it is, 40 to 75% people may have genetic familial propensity for developing obesity. And what we should do to prevent for the monogenic forms of obesity, there are different types of treatments, but the general obesity which we find in families, which runs in families, is that can be prevented by more active lifestyle, more healthy eating, and more proactively taking care of their weight and the oil intake in their overall by the family.
All right, Dr. Kothari, if you can now explain to us what is the role of the hormone leptin in obesity and what happens if leptin levels are high?
So let me first tell you that word leptin is derived from the Greek word which means being thin. Now leptin is a hormone which is produced by white adipose tissue in the body. An amount of leptin in the body is equivalent to the amount of fat mass. So more the fat mass, more the leptin. Now what is the role of leptin? So leptin is a hormone basically which regulates satiety, that is feeling of fullness. It acts as a messenger between the fatty tissue, that is adipose tissue, and a part in the brain called hypothalamus which regulates our feeding mechanism. So basically leptin is a messenger. So if we see in obesity, if leptin levels are high, why are patients really obese? So the whole thing is there is something like leptin resistance. Like in type 2 diabetics, though their insulin levels are high, but still they have type 2 diabetes. So similarly in obese patients, there is resistance to the action of leptin. So leptin being continuously high, when brain should receive the signal for fullness, it doesn't receive the signal for fullness. In addition, because leptin levels are on a higher side, body feels, there is continuous need for the eating of food despite having adequate fat stores. And secondly, the energy expenditure also goes down because body enters the starvation mode. So in the presence of excess amount of leptin and because of the resistance to the action, what happens is at one level we are eating more and at another side we are spending less calories. So this extra calorie balance leads to obesity.
All right, Dr. Ghanekar, what is the relationship between hypothyroidism and weight gain, and can weight gain during hypothyroidism be reversed?
Yes, thank you for that question. It's a very common question because hypothyroidism is a common disorder. So it is very important to understand that when hypothyroidism is uncontrolled, so when the total T3 and total T4 hormones which come from thyroid gland, when their levels are on the lower side, there is a tendency for fluid retention in body. So body retains fluids and body retains a chemical called GAG or glycosaminoglycan. So this because of presence of this fluid and this substance, there is some weight gain. So this weight gain when one is uncontrolled hypothyroid can be to the tune of 3 to 5 kgs. So not all the weight gain that the patients experience while having hypothyroidism is directly linked to hypothyroidism. And once we start treating this hypothyroidism with thyroxine, which is the nothing but the T4 hormone analog, so this weight starts going down. So the fluid starts going down from body and the patients tend to lose weight. So whatever weight that they have gained during the uncontrolled phase of hypothyroidism can be reversed totally after treatment. But in spite of that, many patients have some weight gain. Now this weight gain can be, it's nothing but the abnormal fat as I discussed in the first part. So this weight probably they have gained over a period of time because of slow basal metabolic rate, which can be because of hypothyroidism, and overall fatigue, drowsiness and overall less enthusiasm that the patients experience during this hypothyroidism probably leads to less physical activity, and then there is weight gain because of hypothyroidism.
All right, Dr. Chavan, can obesity can cause various other metabolic disorders. So can you help us clarify how obesity can lead to metabolic disorders?
So, obesity is associated with multiple metabolic disorders, and of that, if you take the definition of metabolic syndrome, the waist circumference more than 94 centimeter for males and more than 80 centimeters for female. This is the IDF criteria, International Diabetes Federation criteria. Along with that, HDL less than 50 for females and less than 40 for males, and triglycerides more than 150 for men and women. Along with BP of 130 by 85, more than 130 by 85 is any three of these criteria are present, we call it as metabolic syndrome. So obesity has a propensity for developing metabolic disorders like dyslipidemia, hypertension, diabetes, and further going on, increased risk of heart disease and cancer also.
All right, Dr. Kothari, now another very important question. How is obesity associated with diabetes? If you could explain this to us.
So we have been dealing with the dual epidemic of obesity and diabetes since a long time. We have always been talking about COVID pandemic since last 2-3 years. But this diabetes pandemic has been there with us for last many years and we have been having tough time fighting it. So what happens is basically there is a hormone called insulin which controls the blood glucose levels, and this hormone is produced by pancreas. What happens is in obese patients there is resistance to the action of the insulin. So the function of this hormone insulin is to push glucose into the muscles and to store it in the liver as a glycogen. Now with obesity, what happens is the fat in the liver prevents its storage. So in addition, because there is resistance to the action of insulin, there is high level of blood glucose. Now over the span of years, pancreas continuously keeps on producing extra amount of insulin to keep blood glucose levels under control. But over years, then it is tired, and finally the insulin production from the pancreas comes down, and that is the time we start seeing high blood glucose levels. So obese patients are 6 times more prone for developing diabetes compared to patients who are lean. We have been seeing many kids also coming nowadays with type 2 diabetes, unlike in many decades before we used to see type 1 diabetic kids and not type 2 diabetic kids. Mind you, not all obese patients get diabetes. If there is a family history, there is unhealthy lifestyle, sedentary habits, or if there is unhealthy gut, there is of course a higher risk of getting diabetes in an obese patient.
Right. Dr. Ghanekar, if you could now tell us what lifestyle measures should one adopt if he or she is already obese and diabetic?
Yes. So managing lifestyle is a cornerstone of management of diabetes, especially if the patient has obesity. And there are 4 parts of this. So one part is the diet management. Second is the management of activity or exercise. Third is stress management. And fourth, which is very important, is limiting or if possible eliminating the unhealthy addictions. So let's talk about the first part, the diet part, which is most important. So ideally, if you can see, this is the plate method that a patient is supposed to follow. So by that what we mean is more than half of the plate should be full of vegetables which are non-starchy. So a patient should have more than half of his plate full of vegetables. Around 25% of the plate should have carbohydrates. These carbohydrates should not be refined. Okay, so refined carbohydrates like flour, the whole wheat flour or maida, what we call, it should not have any added sugars like table sugar, which is sucrose, or anything else like high fructose corn syrup, which is very commonly found in packed foods or junk foods. So all these added sugars should be limited. They should be ideally zero. The refined carbohydrates or flours should be limited. We should more focus on having whole grain foods in carbohydrate compartment, and around 25% of the plate should have proteins, which are lean proteins. That means proteins with low fat. Okay, so because majority of the Indians, I mean, the diet is such that we have this tendency of having high carbohydrates, and that is the reason for this. I mean, that is one cause for this dual epidemic of diabetes and obesity. So the diet, we should aim to reduce carbohydrates. We should increase vegetables and proteins. Second part is activity. So patient is advised to do 30 minutes per day of moderate intensity aerobic activity like walking, jogging, running. It should be around 150 minutes per week, and it should also be coupled with having 2 to 3 sessions of resistance training to develop the muscles in such patients. So developing muscles is also very important in a patient with diabetes, because these muscles take up excessive glucose and the muscles are very active metabolically. So muscles help in digesting the excessive sugar, and then they will help in managing the diabetes better. They will also help in prevention of fall in old age. They will help in supporting the bones. So it is very important to develop muscles in a healthy way by doing resistance training. And third part, as I said, stress management. So it is very important that stress, we should prioritize what we want in life really, and focus our day or our activities around that part, and try to cut down on stress, because high stress is associated with high cortisol hormone, and there are many other hormones which are involved when the patients have high stress levels, and all these hormones directly or indirectly increase blood sugar levels and also prevent weight loss or fat burn. So stress should be on lesser side. And the fourth part is trying to avoid or minimizing addiction. So one should reduce the alcohol. According to the ADA guidelines, for men, the alcohol intake should be limited to 2 drinks per day, not more than 2 drinks per day. And for females, it is not more than 1 drink per day. Tobacco and smoking should be totally no. It should be totally zero. Okay, so this is how we can manage diabetes and obesity in a patient.
All right, important points there. Time for us to slip into a short break, but we'll be back with many more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about obesity as well as hormones. Dr. Mahesh, if you can tell us, are obese people prone to emotional eating, and how can emotional eating be controlled or managed?
So, in India, as such, we associate everything with food. We associate all our happiness, joy, we celebrate with food. So, it's natural that all our patients, everybody is associating their emotions with food. So whenever we tell our patients to reduce their food intake or calorie intake, they feel bad, that they feel that their love is being decreased from their life. So naturally, emotional eating is the major cause for obesity, because that's the only thing which gives us satisfaction. After eating a good meal, you get a maximum satisfaction, and that's why people eat when they are depressed. People eat when they are emotionally disturbed, and that's why these type of emotional, we should dissociate emotional eating from normal eating. See, when the person dissociates emotions from eating, then only he will know that his stomach is full, or he's had his share of food. Many times people keep on eating while they're watching TV or they are discussing something, and that also leads to increased intake of calories and can lead to obesity. So behavioral therapy is one of, and counseling is one of the major mainstays to control emotional eating.
All right, Dr. Kothari, when you're trying to lose weight, it's natural, to want it to happen very quickly, but people with gradual and steady weight loss are more likely to keep the weight off. So how much weight loss is considered appropriate?
So one should set realistic goals. By setting realistic goals, we mean that, they should lose around 0.5 to 1 kg weight per week. Now, to attain this kind of weight loss, what we need is a calorie deficit of 500 to 1000 calories, which can be attained either to having a low calorie diet or through burning more calories, or both of them. Now, any weight loss is beneficial. So what is recommended that even if you lose 5 to 10% of your current excess weight, the risk of diabetes, the risk of hypertension, the dyslipidemia, cardiac risk factors, they do come down dramatically. Even in patients with PCOS and infertility, that is polycystic ovarian syndrome, even 2 to 5% of weight loss is beneficial, and it has shown to improve menstrual cycles and help with fertility. In certain conditions like NAFLD, that is fatty liver, or in patients with sleep apnea, around 10 to 15% of weight loss translates into beneficial, healthy weight loss. What is more important for people to know is, in every patient, it is not possible to attain a weight, BMI of around 25 kg per meter square. But as I said, any weight loss is beneficial. It does improve our metabolic parameters to great extent, and it gives feel-good factors. So set realistic goals, and it is possible to attain weight loss.
All right, Dr. Ghanekar, various prescription treatments for obesity are available on the internet, and as a doctor, advice around that. Do these medications really work for weight loss, and is it safe to take these medications?
Yes, so currently there are many, many advices and many medicines which are available for weight loss. Some of these are from modern medicine, or what we call as allopathy, and some are from the alternative streams. So it is very important that we put this in the proper perspective. So most important measure for weight loss is lifestyle modification. None of these medicines can come close to that, the results which can be achieved by lifestyle management. So as far as available medicines which are considered, so these medicines can be either those which suppress the appetite of the patient. They will be useful in patients who have excessive hunger. They will help in cutting down the hunger, but their adverse effects are like nausea, vomiting, feeling of bloatedness throughout the day. Second type of medicines which are available are those which reduce the absorption of nutrients from the intestine. So there are medications which reduce fat absorption from intestine, but these are associated with, again, nausea, sometimes vomiting, and many times associated with loose stools, because the fat which is not absorbed in the body is thrown out in the stools. So these patients can get loose, oily stools. They can have excessive flatulence and all those things. Third type of medications which are relatively new and which are more effective than the others are those which target a hormone in the intestines called GLP-1. So these medicines which are available, or GLP-1 analogs, they are more effective compared to the others, and one of the recent ones is can cause a weight loss of up to 5 to 10 kilograms, but it is important to maintain this weight loss. So this is also associated many times with side effects like nausea or vomiting, vomiting, and sometimes even loose motions and flatulence. So we have to take the medications with a pinch of salt. We have to know that there is, having a medicine is not like a magic pill. There is no magic pill for weight loss here. These are going to have some adverse effects, and so we have to be, we have to promote this idea that the patient should take these medications only on prescription from their regular physician. They should not just go randomly on any website and order these for themselves. So self-medication and medication from unauthorized sources should be avoided. And yes, there are few medications with some efficacy, but we have to be ready for the adverse effects.
All right. Dr. Mahesh, is a gastric balloon a good treatment option for obesity?
Okay, so gastric balloon therapy can be is now indicated for patients with BMI more than 27 to 30, and it can also be used as a bridge therapy before the patient goes for a gastric bypass therapy. It can cause almost 8 to 15% of weight loss, and there are different types of balloons which are being approved by US FDA. One of them is injecting a balloon with 400 to 700 ml saline in it, and that has to be removed every 6 months. And another is a gas-filled balloon, which needs to be, there are 3 balloons, which every month 1 balloon is inserted. But and there is another therapy is where a balloon is inserted in the, it's like a barrier, acts like a barrier from the stomach, and so that the digestive juices do not interact with the food, and it goes up to the duodenum and upper part of the jejunum. So, but the problem with these balloon therapies is that once you stop using the balloon, you may regain the weight which is lost. And there are multiple contraindications, like people who are having liver disease, those who are having hiatus hernia, or pregnancy or chronic NSAID use cannot use these balloons, and there are chances of rupture of this balloon, or acute pancreatitis or migration of the balloon, and causing further GI complications.
All right, Dr. Kothari, that leads us to the next question about the benefits of bariatric surgery.
So as my colleagues have already said, it is hard to lose weight, but it is even harder to maintain that weight loss. So here comes the importance of bariatric surgery. It is a kind of surgery which helps patient to maintain the weight loss, and it's specifically indicated in patients who have made previous attempts to lose weight, but they have not been, successful at losing weight, or they have lost but not been able to maintain that weight loss. So for Indians, the cutoff for bariatric surgery are different compared to Caucasians. We Indians are more fat on our belly, so we call it thin fat Indians. So the indications are any patient whose body mass index is more than 37.5 kg per meter square, or if it is more than 32.5 kg per meter square but has metabolic complications like diabetes, heart disease, they have hypertension, dyslipidemia, or obstructive sleep apnea. Now, bariatric surgery basically helps in weight loss to a greater extent compared to what we can attain through lifestyle modification. So patients start feeling good, they feel there is a sense of self-control and confidence rather than a feeling of self-consciousness. In addition, with bariatric surgery, now we call it as a metabolic surgery because it helps in either improvement or reversal of metabolic comorbidities associated with obesity like diabetes, hypertension, dyslipidemia, and even cancer to some extent. In addition, it has shown to improve patients' depressive symptoms. It has shown to improve mobility in patients specifically with osteoarthritis and urinary stress incontinence. But what one needs to remember is bariatric surgery is not a shortcut to lifestyle modification. It is one of the ways by which we can improve weight loss along with lifestyle modification. So bariatric surgery should not be considered as a shortcut pill or elixir for weight loss.
All right. Thank you so much, doctors, for joining us today on this program and, answering all those questions and creating awareness about this very, very important issue. Thank you all for watching at home. Time for us to slip into a short break. News updates continue on NDTV.